Hi everyone, it's Nigel Giam here, the lead GP training program director for the St Mary's Scheme and course director for Mentor MRCGP. I'm very, very happy to have Shweta join us today to talk about her recent smashing of the October SCA exam. It's so nice to see you and congratulations. Well done.
Thank you so much. Thank you.
No, I mean, it's an absolute pleasure. I mean, you and I have obviously worked together on this for a few months now,
Hmm.
but it didn't all start, I suppose, with happy roses, because obviously you've taken the exam once before. Your
Yes.
mark is huge. I mean, you're in the 90s, a huge point increase. But I suppose before we get into that, maybe just a little bit
Mhm.
about yourself and how you kind of came into general practice training.
Yeah, so I always wanted to go into surgery initially, but I did my FY2 in general practice and I really enjoyed it. I liked seeing the range of patients. I
Yeah.
liked following up different families, different family members, and just having that contact with them. So I thought it was a really good way to experience medicine. Um, and also involving in sort of minor procedures,
Yes.
surgical procedures as well. So GP is a good variety of things that you can do.
Absolutely. And I suppose the SCA definitely tests a variety of things that can kind of walk in through the door. It's interesting, isn't it? Because I think a lot of us, when we go through medical school, don't necessarily get that exposure to general practice. And a lot of what we do is quite clinical, especially the exams.
Hmm.
Um, I know that when you first came to see me on the masterclass, and then we had a one-to-one, it was really close to the exam at that point. And I think you knew at that point it was going to be maybe a little bit touch and go just
Yeah.
because of what I suppose I was saying the exam was testing and what people often perceive it to be. I mean, before we get into our game changers, what do you think people actually think the exam's testing them on? Because a lot of people study in the wrong way for this. Um,
Yeah, I agree. So when I first was introduced to the exam and revising for it, it was very much, follow the template
yeah,
and just it's kind of like tick boxing
yeah,
all the different parts of the history taking and then throw a bit of ice in there.
yeah,
And
yeah,
that's what it was made out to be.
yeah.
But it's not like that at all.
It is.
It's not at
I
all.
know, I know, I know. And I think sometimes one does kind of have to go through it and then go, uh-oh, that's not what I thought it was going to be. So if we now think about, I suppose, those who are going to be sitting it or resitting it, what would your main messages be if we break it down into the three domains, data
Mhm.
gathering? How do you go about making sure that you're going to pass this domain and pass it well?
Yeah, so for me, because this was my second sitting, the first time I sat it, I just kind of went in, was very symptom chasing, as you know, Nigel. But I think this time round, I really started up and opened up LICEF
Yeah,
early on, which really unlocked the story, the
yeah,
patient story, because like you say, it is a really narrative-based exam.
yeah, yeah.
So really opening up LICEF early, trying to ask the story, the narrative,
Yes.
and I can't express this enough, but following and never parking the queues as
Cues.
well is
Yeah.
so important.
It's so important because a simulator will try and help you. And I think the analogy that I talk about and you'll definitely be familiar with is it's a bit like an onion. You just got to keep unlayering it until you get to the core of where you need to be. And the simulator will try, but they can only really drop that cue a couple of times. And if you park it, then the tendency is you're going to actually miss what the case is about.
Hmm.
I mean, for
Yeah.
our audience, you may have come across LICEF having watched the other case studies, but ICE in itself is not really enough these days. We need to understand the impact it's having on the patient's life, their situation, and actually the feelings that go along with that, because we don't want anything to be robotic. When it comes to clinical management, what would you say your game changers were there?
So always try and keep up to date with the NICE guidelines, of course, that's a must. And I think trying to relate it back to their LICEF at
Yeah.
the end is really important because it shows that you've actively been listening to the patient and their story.
Yeah, I think it's so important when you come into that second half is not to become too diagnostic. And yes, ultimately we're seeing, and wanting to see that you apply good evidence-based practice, but it's so important that that doesn't come at the expense of managing the
Hmm.
patient. Ultimately clinical knowledge we tested a bit, but it's not really a clinical knowledge exam. It's very much about how you relate to others, and that is a nice segue into that, I suppose, domain What were your game changers there in relating to others?
Relating to others, so as I said before, I was very formulaic initially when I was first taking the history and doing the cases, but I think I really slowed down.
Yeah,
I made it more conversational. I
yeah,
made it like I was talking to a friend, like you've
yeah.
suggested, and yeah, it just proved to my marks at the end that that's the way to go to score high in the relating to others part.
It is. It's so much about, talking with, not talking at, and not having a
Yeah,
preset agenda. I like that analogy actually, because I do say that a lot. It's imagine you're just having a conversation with a friend.
yeah,
Because if you do that, then the rapport actually builds up very naturally, and actually simulators by default will generally tend to open up
yeah.
quicker, give you a bit more information. Um, so I suppose, you're going to have a number of people out here who are listening to this thinking, how do I get this together now? I've got to spend the festive period preparing. It's,
Mhm.
my second resit or my third resit or maybe even my fourth resit. What can we do to get the energy up out there? What would your messages of hope be for our audience?
Yeah. So don't give up. You will get there. You will get there. I was really upset the first time I failed, but with good practice and applying the skills from the masterclass really, and also just the one-to-ones I had with
Yeah.
you was really helpful for me. Um, yeah, just making sure that you're following the game changers really will help, and you will get there in the end.
Yeah, no, thank you. And you mentioned good practice, and I think that's really important, isn't it? Because a lot of people work so hard for this, but they don't work particularly smart. Um, if you had to find a good study buddy, what
Mhm,
would you want that study buddy to be doing for you when you practice?
mhm. So that's a good thing to ask about because I did practice with a lot of people who weren't who didn't attend your masterclass, and the way that they studied and the way that they practiced was completely different
Yeah.
and very formulaic as well.
Yeah.
Whether that works for them or not, I'm
Mm,
not sure. But I think if you can practice with people who are in the masterclass
yeah.
or who have had sessions with you in the past, it's quite good. And then just replaying your videos
Yeah.
back again and watching where you could improve on
Mhm.
is really useful.
It's that cycle of feedback, isn't it, which I think is really important in actioning it. And this is by no means saying, everyone come on the masterclass, but it's about taking in, I suppose, the right messages and about qualitative practice and calling out both bad and good behaviors so that you
Yeah,
know what you're doing. Because otherwise the tendency is just to sit going through the casebook. And that unfortunately just makes you a symptom chaser again, and that's
yeah.
not where we want to be. Well, look, thank you so much for giving up your time to do this interview. What's the plan? I mean, now you've got this all done and dusted. It's going to be exciting times. What are your plans now?
Yeah, so my plans are to take a break from studying. I'm going to
Good.
go traveling for a bit in South America, so that'll be good.
Lovely.
Yeah.
Amazing.
And then I'll probably get a salary GP job somewhere here and
Yes.
do bits and bobs of other things.
Lovely. Well, listen, the world is your oyster. There is no rush, so do enjoy your time out.
Okay.
And if there's anything I can do to help you, obviously post CCT, please keep in touch.
Thank you. And again, Nigel, thank you so much. You really, really have helped me.
My pleasure. Absolute pleasure. Thank you so much. You take
Thank
care.
you. All
Okay.
right. Bye. Bye.